First of all, I think it's important for researchers to discuss how to handle material from, for example, a patient with a lymphoma who also has a primary immunodeficiency. So the oncologists, they will put it in a sort of next generation sequencing, and they will look at certain genes. A PID specialist would maybe look at the same genes or other genes, use different panels, so there might be overlap, and we could just focus better there if we would communicate with each other. So the material of these patients is very precious because you will only get it once a diagnosis. And so from a scientific point of view, how to handle this material while doing your research, it's very important that you know where to go, what to do with it, and not just look at it from the oncologic point of view or from the immunological point of view. On the other hand, as a clinician, I'm a clinician, and so when we are doing our daily clinical practice, we run into clinical problems. So for example, there is a certain group of patients with a primary immunodeficiency based on the deficiency in repairing your DNA. And so these patients usually present with a immunodeficiency early in life and might develop a lymphoma or leukemia later on in life. Well, these patients for an oncologist are very difficult to treat, and there are all kinds of weird complications. So especially if the diagnosis has not been made or the symptoms of the PID are very subtle, you as an oncologist, you run into these complications and you don't know what's going on. So it is important to learn, to teach each other how to identify these patients, and then to sit together how to treat them, how to diagnose, how to screen, in order to give these patients the best possible care. So there's so much that we could learn from each other if we could share our knowledge and have a sort of common platform to exchange ideas and exchange our scientific insights. So therefore I think this meeting is really important and really focusing on the future.